but I'm gonna try to figure this out the best I can. I just hit record, so that's good. I also just shared something in the chat, so feel free to open that up right now if you want to, or at least be ready for it. And I'm going to request that one of you be so kind as to re-share that in the chat about halfway through when we start to explore this a little more. In case some latecomers show up, they'll be able to get that link as well. So Abby, do you think you could do that for me? I see that you're there. So, you know, with the other ones, they might be like our students, you know, is Stephanie actually there? Or who knows? Not to call you out, Stephanie, but I guess I just did. Anyways, I don't want to get too far off track here. So let's just begin. Welcome. I'm going to be talking about models and modeling during COVID-19. I am Drew Rholl. I teach at North Park University in the biology department, and I'm excited to talk about this project. So just an overview of what I'm going to chat about today. First of all, what are models and how are they used in science teaching? I was a complete novice to this, which I'll explain a little later, until just this spring. And then I'm going to actually unpack two different activities that you can choose and to use either one or the other or both, and they're highly modifiable, so that's a good thing. And then I just want to give a plug for JMDE, which is a great journal that's out there. So at any point in time, if you have questions, please just unmute yourself and let me know what you have. So first of all, why do we model in the classroom? So AAAS and next generation science standards, so AAAS's vision and change document has identified modeling and simulations as extremely important to science education. And they did so because simulations have been shown to be, through countless studies, an effective active learning technique. They help students learn major concepts by engaging with them at multiple times and by really being an active technique. They actually help explain more complex problems and specifically complex systems. And I'll talk about what exactly complex systems are a little later in this talk. And almost one of the most important things for me is that creating models has been shown to actually help students develop as scientists. So not just understand a topic, not just regurgitate a topic, but actually be able to develop parts of their brain that are going to have them think deeper and problem solve later on. So I think this is often overlooked when we're so worried about content, but we really wish our students could think deeper. So creating models, not just using them, but creating them, accesses those creative parts of our brain and abilities. And then simulations and models can serve as great substitutes for physical labs. I'm sure many of you are looking for such substitutes in this current climate, especially as it gets colder and more people get sick and we need to do more social distancing. So a lot of great reasons to actually do modeling in the classroom. And then at the end of this talk, I have a whole bunch of references that I'm talking about here. So quick disclaimer, this is me at work. So notice I'm not at a computer, I'm at the bench. So I'm a molecular bacteriologist by trade. So I am not a trained modeler, I'm not a trained coder, I'm not a trained epidemiologist, insert all these other things that I'm not good at. But what I am is a learner. So what I did is the way that I got inspired about this project is I actually did a Coursera course on something called Biograph. And if you have a decent chunk of time to spend and really commit to a Coursera, an online course, I suggest you check it out. It's really cool. It teaches this coding that I'm talking about. Once again, that's Biograph. And they don't offer it all the time because it is a synchronous course. But it's about using modeling and coding to teach high school biology. But that's the root of what I did in this part two of my talk here. So my first activity is pretty simple, and I think all of us could use this very easily. And it's basically evaluating published models of disease transmission. And just to give you a little bit of background about when I did this, where I did this, it was at the beginning of an upper level biology elective course called PEDNEVICS. So it was a topics course. It was completely asynchronous. And the only requirement was that students have taken general microbiology at some point. So it could have been, 2 years ago, it could have been just the semester before. And all I asked them to do was evaluate these 4 published models and then just select favorite and least favorite and provide rationale with that. And then the students posted their replies or their posts to a discussion board and talked with each other about what they came up with. And this activity was meant to be truly exploratory, and that's it. Because the way that I used this was to set it up for the second activity, which I'm going to talk about later. But it was just to see what was out there in terms of modeling. And once again, this was at the very beginning of the semester. So I just wanted to get on the same page. And what I did is I gave them these 4 different models. And the first one was this model from the Washington Post, and maybe some of you have seen it, but it was called Why Outbreaks Like Coronavirus Spread Exponentially and How to Flatten the Curve. And student feedback said that this was extremely easy. They liked it because it was clean and linear, and it was supported by well-written explanations. So you can look up this model, and as you look at this page, basically as you scroll down, it becomes increasingly more involved. It's building off of the simple idea that when 2 dots hit each other, you could spread the infection. And then it moves towards, what happens when we do different kinds of social distancing or things like that. So it was really great in terms of preliminary understanding of what models are. But a lot of them didn't like it because there was no flexibility whatsoever. So you go down the page, new things pop up, the same thing happens every time. There's no surprises, there's no play. And so it was very limited in that way, no variation possible. So I think some of the students who were less confident liked this one because there were good explanations. This was meant for the lay population, not scientists. But most people didn't like it. The next one was way more complex, and it was from the COVID-19 sim from Harvard Medical School. And this is based on real current data. And so they take wherever we are at this point in time, and they're going to ask you, what do you think would happen, or let's model what would happen if we have a lockdown or stay-at-home orders or whatever we are currently. And maybe we do that for 1 week or 8 weeks. And so you get to pick the time frame for these different interventions, and they say, they show you what's going to happen. So right now, I'm sure you're all aware that this is where we are. So I ran this this simulation here a couple days ago. And it said with our current interventions, we're going up, right? And here's our confidence interval, but chances are we're going up for a while. But if the United States did a stay-at-home order for a couple of weeks, if they go into lockdown after that, this is what's going to happen to the curve. So these are, of course, predictions, but it's really fun to play around with. And so students really liked this because it was based on current data. And it was also a really focused analysis of real public health policies that they're aware of, that they've lived with. And they've seen certain parts of the country use them and other parts not. So they really liked that. But again, some people didn't like it because it was limited flexibility. The only interactivity was choosing the actual strategies, and then you just hit, analyze, and that's the end of it. There were no animations, it was just the graph. So the people that liked to see the situation evolve didn't like this one as much. And then we have Outbreak at meltingasphalt.com. And this one was really cool. This was most people's favorite, not everybody's, but a lot of people's favorite. Just like the Washington Post, you scroll down and there are increasing complexity within the models. But the thing that this website had that Washington Post did not was sliders. So they got to talk about what's the fatality rate, how many encounters per day, what's your travel radius, transmission rate, and then you could have these increasingly complex situations where you could provide the flexibility and the variables, and then it would show you what happens over time. So in addition, it had good explanations. So this one had pretty much everything. The thing that people didn't like about it was that it was a little stylized. So these are the humans, and it just kind of went in and then out. Also, some people were daunted by there being too many choices and variables. but this was the standout for most students. And then this is the last one that we did. So this is a Star Logo Novo academic simulation, and it uses the platform that I'm actually going to talk about later for coding. Now this is, students liked it because it's open source, which means that you get to actually go into the code and play around with it. And also you were able to create sliders that had a good graph, and it shows these guys walking around and coughing on each other, which is kind of fun to see. And also there's a huge variety of simulations that are out there, continually being published, and again, flexible in terms of if you can code. Now, what people didn't like is that it took a while to get used to how these things are actually run. So people were confused by that because this was their first encounter with it. And if you don't know how to code, there's only the flexibility provided by the platform, by the coder themselves. So they didn't really like that. And some people thought it was a little too old school of graphics. So those were the complaints and also the praises for each of these. So just in summary, this is a highly flexible activity. You can keep it simple, just like I did, and basically say, which one did you like best and why? You could also ask, what does each model show you about disease spread? So this is something that could be done in a microbes and society non-majors course, or at the very beginning of an infectious disease course like I did. You can also get it a little more complex, maybe ask things like compare the pros and cons of each simulation. You could go even more challenging and talk about evaluating the problems with each model. Who's the target audience? What background knowledge would make the model more effective to use? So clearly, this is a really versatile type experiment. Also, it's extremely timely and relevant. So the students were clearly interested in understanding disease transmission. Of course, they were taking a course called pandemics, so that kind of made sense. But it was I think a success, even with its simplicity. So I just want to pause for a second. Does anybody have any quick thoughts or questions about the first activity before we pop over to the second one? It's pretty straightforward. I don't expect much. Okay. The next one was much more complex and much more involved. And this is the block-based coding project, and they're going to create new models of disease transmission. And for background, it's the same exact students. It was 1 month into this course, so they'd already seen the general models that I talked to you about before. It was still asynchronous, except that I did have a midpoint check-in with them, and some students met up with me virtually quite often or had email correspondence with me. But then in the beginning, I just approved of the variable that they were going to analyze. Aside from that, they were on their own. There were really good references and documents, they call them, guides to doing the coding, and their videos online. So some students just didn't need me at all and did a great job. This was designed with two different purposes. First of all, to introduce coding, but to non-science or computer science students that had potentially no experience, but also to try to develop a model that would talk about a variable having to do with disease transmission. The data that you're going to see is evaluated by just a small survey. So 16 finished the pre, 11 finished the post survey, and I was able to do some analysis on that, very minor stuff. But these 5 students that didn't complete just didn't do the survey, and I did it anonymously. Everybody finished the activity, they just didn't do the survey. And to give you an example or an idea of my population, vast majority were female, some non-binary, some prefer not to say, just a couple males. So before I get into what we did, just to understand the idea of complex systems, because I will admit that I hadn't really heard this term previously, but it's one that students are becoming increasingly exposed to, especially in high school and middle school. So Aristotle basically said that the whole is more than the sum of its parts, and that's what the complex system is. It's trying to understand multiple agents within a population who are acting dictated by rules. So they have a certain set of rules that they follow, but these populations are going to fluctuate. They're going to change they could stabilize, but they could reach some sort of homeostasis, or something like the predator-prey relationship that many of us are used to, where you have the prey go up and then the predator follows, and then there's too much predator and the prey goes down, and so forth. So this is a great example of a complex system where we have different entities acting upon each other and affecting each other, but still following rules. So one of the things that I did in my surveys is I asked students to explain how do complex systems help healthcare, or how do understanding complex systems, how are they used in healthcare? And what I did is I did a pre-post. Your bar is in front of me, your face is or in front of the text, but this is now I forget what it is. There it is. So blue is both. The green is post only, so that's growth, and then the orange is pre only. So what we see happening here is that students talked about variables. They didn't talk about variables or factors in the beginning at all, or I'm sorry, they did a little bit, but most of them had growth afterwards. Pretty much everyone talks about variables and factors at the end. A lot of them talked about the simulations after the fact, but not in the beginning at all. They talked about interactions maybe a little bit, but most of them learned about the idea of interacting factors and agents. And then prediction was a big one that saw some growth. So students started to understand how complex systems can actually be used to predict, to model and do this with different variables. So they understood the complex systems more. And then as far as confidence goes, I can modify computer code to answer questions about biology. So at the beginning, no, nobody really could. So 2 students or 3 students said, yeah, maybe I can. Towards the end, a majority said, maybe I can, but also, a near majority said, yes, they could in some way. So there was a holdout who maybe crashed and burned on the project, but most people had definite signs of growth in their confidence about coding. And additionally, they understood how being able to use code and write code, modify code would be helpful for researchers studying new disease. So here we have, a bunch of people disagree. I think these could have been the people trying to gain my approval by saying, yeah, I understand that beforehand. But then after the fact, it was either neutral or everybody agreed. So anyway, some growth there. Now, what I want to do is I want to share with you this model that I made. So in the chat bar, that's the link that I am giving you, so you can check this out. And we can ask questions like, what happens when we vaccinate against a new disease? And then evaluate the level of protection provided by the vaccine, the level of coverage, so how many people get the vaccine, and then the speed of vaccine development. So we can code all of this. And so what I'd like you to do right now is, I don't know if we don't have actually the names work out perfectly. I'm not sure how, I'm sorry, one person needs to move. Stephanie, if you could bump over to the Z, that would, or the last one, that would be great. But what I want you to do is open up that link. Thank you. Open up the link, and I want you to set up your parameters. So use those slide bars. The A to E, so I think that's Tracy. You don't have to do anything. You're just going to hit setup and then mingle. And then you could see the rest of your assignments. So we have 90% coverage for our protection and 50% coverage, 50 protection, 90 coverage, and then 90 and 90. And what you'll see is for those people who are going to vaccinate, there's actually a vaccinate button. And so you're going to have to press that button at about 2 weeks or 14 days. So what you're going to do is click setup, then mingle, and the guys are going to start moving, and then we're going to see what happens. So I'm going to try to open that up, and feel free to play with it. I'm just going to, for those of you who maybe don't like websites as much as others, I'm going to try to go through that process. But hopefully you're watching the simulations right now. So here I have my setup. I can change my coverage maybe to 50% and 50%. And then I hit setup. So if I want to, I can click edit camera and I can use my scroll bar to see in a little closer, and I can lock the camera. I'm going to hit mingle to get them going. And then you can also speed up the process. So in that top right, you see engine speed. So just for the sake of time, feel free to increase that. But you can obviously decrease it just to see what exactly is happening there. So we'll let this go for a little while. Does anybody have questions? Is anybody having trouble with it? Doing okay so far? All right. So clearly this is not the most complex or intricate or potentially accurate model because we just have spinning circles. All those little green things are actually droplets. So when people run into droplets, they potentially get sick. We can actually change how often people cover their mouths. In other words, how much of the cough is being released. And we can change how much they move as well with that social circle aspect. And as you're continuing to run your model, I just want to show you what the coding looks like. So this is it. There's a whole menu of different options here on the left. And basically you just drag an idea or a piece of logic over into the coding area. And then you're going to type in whatever variables you have and how you want them to act with each other. So for this scenario, just to give you a decent idea, what I did is I went, my computer's kind of old. So I went as a person here and I said, let's see here. When I hit a droplet, if my color is yellow, which I denoted as healthy, I want there to be a 20% chance that I get sick, that I turn to red. And that's one piece of logic right there. Super easy to build. And once the students build that, then they can get a little more complex. And they can say, okay, if my color is blue, which is immune, then depending on what my vaccine protection slider says, if I have a lot of protection or little protection, I'm going to get sick again, turn red again at this rate. And they can play with that. And so they have to come up with all these mathematical rules as well as just general logic and coding rules. So there's not a ton of coding blocks that are in here, maybe only 15, something like that. But as students gained confidence, they were able to explore and also adapt them. Every once in a while, a student would have a movement where their organisms or their agents would just go nuts. And they'd have to figure out, where did that come from? And so there was a lot of problem solving here. All right, so what I want to do right now is go through what potentially could have happened. So this was the first scenario. And so this, I think, would have been Tracy, right? Did yours look kind of like this, Tracy? Where at about 200 days, maybe you had, about 800 deaths, give or take. Keeping in mind, and you could just give me a thumbs up or a thumb down, or talk, yeah. Cool. So these are random, right? So the way that these occur, they're random chance based on parameters. So it's possible that ours were different, and so this is where replication is going to be necessary, and that's a good lesson for students as well. So this was hopefully, yeah, there's the next one. So this would be Stephanie's. Stephanie, does this kind of look like what you had? So
Sorry, it took me a while to unmute, yes.
Okay, so we had a lot of vaccination in the beginning, but also we had really good, or I'm sorry, what did I give you? Was yours 50? Oh, there it is. Yeah, the coverage was 50. Oh shoot, we're pretty much done.
I started at 50 and then I moved it to 90, so that's why it's
all right, so you're trying to save the world, okay. All right, well, we don't have much time, unfortunately, but I hope that you did kind of get some confidence from this. Students really enjoyed it. They basically, one student said, I thought it was like hacking a system. Like, it's not. But once they got into it, some students said that they were terrified at first, but they really liked it. So I thought it was great. It was a fun activity. A lot of students were very thankful for it. Next time I would do more check-ins for sure. And the other thing is, please check out JIMBY, Journal of Microbiology and Biology Education. This idea was just accepted last week, so it should be published in this winter special, which is Teaching in Times of Crisis, which is obviously a very important issue.
Hope everybody's enjoying your internet speed dating. Your next group in just a moment here. We'll switch the slides so you can see where everything is. And as always, you should see the breakout rooms on the bottom of your screen. And if you don't worry. Just send Christine Drover or me a private message, a direct message, and we'll get you right into the room you want.